Hi, my name is Sarah. I'm now going to be doing my moisture dry dressing change. The first thing I'm going to do is verify the physician's order that this is in place, that I'm going to gather all of my supplies, and I will walk you through what I gathered here. So I have sterile gloves, I have a new ABD pad, I have a couple packages of gauze, so I'll do 1 to 2, and then I have a kit that has the forceps in it, steri strips, measuring tape, and a clean, it's not called a Q-tip, cotton tipped, I can't remember the name of this, I'm gonna call it like a Q-tip for now. And then tape, of course, for the after the dressing, and then normal saline for cleansing. So I have all my supplies. I'm also ensuring they're not expired. The first thing that I'm gonna do is knock, introduce myself, identifying the patient using name, date of birth, checking if they have any allergies, explaining what I'm about to do to the patient, providing privacy, washing my hands. I'm gonna wash my hands, doing my hand hygiene, and then if there were any medications involved, like a treatment, then I would do the 3 checks and the 7 rights. Okay, so the first thing I'm gonna do is assess the patient for any pain. If they are experiencing pain, then I would pre-medicate them 30 to 45 minutes before I start the procedure. Patient's not experiencing pain, so I did my hand hygiene. I am now going to apply clean gloves. So my gloves are on. I am going to, of course, look at the outside of the dressing, see if there's any drainage that is seeping through the ABD pad. No drainage present, so I'm going to remove the tape 1 layer at a time, parallel to the patient's skin, and then I am going to remove the old dressing. I'm also looking at the drainage that's inside of the dressing. I'm noting the color, the smell, the amount, and then I'm going to do 1 layer at a time, and I'm kind of just going to scoop it into the old dressing, and then I'm going to take out the packed amount as well. So all of this is here. If any of this was to get stuck or was sticky, I could add normal saline to the wound to kind of loosen it up so that it's not pulling at the wound as I remove it. So now I'm going to dispose of the old supplies, and then I'm going, okay, so I've performed hand hygiene, and I've put on my new gloves. Now I'm gonna assess the wound for the size. I'm gonna assess RETA, so redness, edema, ecchymosis, drainage, and approximation. And then I'm gonna also include measuring it. So I'm gonna measure the wound from top to bottom. So I would do, it is, I would say 14 centimeters long. Three centimeters wide, and then I'm going to do my fingers on the cotton tip, and 3 centimeters deep, so 14 by 3 by 3. And then I am going to continue with my my cotton applicator, and I'm just going to be assessing the wound for any tunneling and any of the barreling. Okay, no tunneling, no barreling. I am going to then clean the wound. So I had already added saline to my clean gauze, and I am going to clean it from the outside straight down, dispose, the other side straight down, dispose, and then straight down the middle and dispose. So now the wound is clean. I am going to remove my gloves and perform hand hygiene. So hand hygiene. Now I am going to open all of my new dressings. So now I'm going to open the gauze, ensuring that I don't touch anything there. I'm going to open the kit that has my forceps in it, as well as open up my sterile glove packaging. And at this point, I would also At this point, I would also add the normal saline to my gauze, just like that. Okay, so now I'm going to open up my glove. Okay, and then I'm just ensuring that I'm maintaining sterility by only touching the outer 1-inch border of the packaging. Okay, so at this point, I am going to be putting on my sterile gloves. So I'm going to start with my non-dominant hand. And then I'm going to do my dominant hand. Okay, so now I'm in sterile glove, and at this point I am going to wring out excess sodium from the gauze. And then I am going to grab my sterile forceps, and I am going to open, I'm going to open the gauze into a single layer, and I am going to begin packing the wound. So at this point, this is sterile gauze. I'm now packing the wound, one layer, just like that, ensuring that no wet edges are over the wound. So that's now packed. And then I am going to add in my dry gauze over top of that, and then my new ABD pad. So we're pretending there's not tape all over this one. And I am going to put the ABD pad over there. And then at this point, I am going to put tape around the borders of this, ensuring that anything's not packed too tightly. And of course, this outside, I'm no longer worried about sterility because I'm no longer inside the wound. So I'm taping around. I am then removing my gloves. I would tape all the way around. I would remove my gloves, and then I am going to put my initials, the date, and the time that I changed this on the outside, or whatever the agency policy is. I'm disposing of all of my used supplies, and then I'm going to perform hand hygiene, and I am going to position the client back for comfort, and then I'm going to document the procedure, how the wound looked, and how the client tolerated it.